Welcome back. Functional systems in the Free State health sector remain one of the biggest challenges that need urgent attention. And this is according to Provincial Health MEC Monyatso Mahlatsi, who delivered his budget vote earlier in the week. Mahlatsi says agreements have been reached with Provincial Treasury about vacancies that need to be filled, which will put the department in a better position to respond to challenges in the province's healthcare facilities. Mahlatsi has emphasized the need for a systems facelift that will enable facilities to operate both independently and in collaboration. All right, and for more on this, we're now joined by the Free State MEC for Health, Monyatso Mahlatsi, and he joins us now via our video link. MEC, thank you so much for your time this evening here on SABC News. I mean, looking at, the budget vote speech that you have delivered on, one would say that it seems as if, when it comes to the filling of vacancies in healthcare facilities, it's something that you have prioritized.
Thank you very much. Yes, the issue of filling of vacancies is something that we have prioritized because we understand that healthcare is a labor-intensive program, and that is why we have been engaging since we have been sworn in, particularly myself here at Health. I've been engaging with Treasury to ensure that we fill as many positions as possible, but key to that is the positions of junior and senior management who are at facility level, because that's where we are lacking most of the time. Many of our hospitals are lacking CEOs, and that is hampering our systems for them to be functional at an optimal level.
And I mean, earlier on in the year, just after you were elected into your position, or of course installed into your position by the Premier of the province, one would say that I remember you going and visiting and inspecting, the various hospitals in the province. Would you say that, this decision to prioritize these vacancies in the hospitals actually stemmed from that? Because you found a number of problems, and one would say that's also due to a lack of leadership.
Well, what we found is that the number of positions that are vacant in our facilities and in the department in general are hampering our communication system. And because communication is a two-way kind of process, sometimes you find that requests for the filling of positions just go one way up, and when there is a need for substantiating and the need for more information, it becomes quite a hassle. So I believe that what we observed when we went into facilities was a manifestation of systems which are not functioning at an optimal level, and we lack human resources to ensure that those systems are functional. Yes, you are correct. My observation and the observation of the team that I'm working with is that if we can be able to fill the positions of management at the operational level, a lot of things can then be addressed. But most importantly, we need to fill the positions on the front line and the bedside of our patients, and that is our number one prize.
And when it comes to this budget that you have tabled of 13.7 billion rand, perhaps take us through as well in terms of when it comes to the services that the people of the Free State need, what else does it aim to prioritize?
Health is quite a complicated, activity if one. So there's quite a number of programs that are unfolding within the department. Yes, the budget, operational cost and the running cost of the department, and at least now the department has an approved budget from which it can be able to operate. Secondly, is ensuring that our systems are beginning to function. And the first one that we've been speaking about is the one that addresses leadership and communication challenges in relation to filling of leadership positions. The other part is about building and strengthening our digital and our electronic systems, because we want to move from the current paper-based filing system to a system where the files of our patient will be, kept on an electronic version, because the manual system takes a long time for our patients to access their files, and it delays healthcare system on a number of fronts, and it also has a number of shortcomings, because we're not able to trace when a patient moves from clinic A to clinic B. We are not able to trace the file and the medical record of the patient, and the quality of care is thus compromised. So for us, digital health, digitizing our filing system is something that we can be able to move forward with. The other part is, while getting ready to deal with the current pandemic that is unfolding of gender-based violence, we working together with the NPA, putting up structures in the form of Tutukani, centers. Tutuzela centers, where we're going to be able to take care of the victims of GBV, and we're also going to be able to assist the criminal justice cluster, so that justice can then be delivered. And
all right, MEC, and
yes,
one would ask as well, on that note, I mean, one would say that, when it comes to your political career, many would know you with the background of being a unionist. And this time around, when you've had to table this budget, how different was it for you, and especially with the position that actually held formerly as a unionist, and now to be on the other side of, the spectrum?
Yes, it's quite an eerie feeling, but I understand that I'm still serving my people and my community even through this process. I think that's what gives me comfort and makes me sleep at night. But it's actually a very strange feeling when one has to deal with issues from a different perspective.
And, what are the tough decisions that actually had to take, particularly during this budget vote? And, previously, these are things that you actually fought against.
Fortunately, there hasn't been those kind of decisions that one had to take, which may, be seen going against my principles, because even when I was still working for COSATU, I still subscribe to a particular set of principles, which I think is still applicable at this point. And key for me is the issue that we need to be delivering quality service to our clients, which is our patients across our facilities. And I think even whilst I was still at the level of the trade union, one of the things that made us to cross swords with management at that level would be issues to say, but these are things that are required to ensure quality service to our clients and our patients. So I'm still subscribing to the same set of values, and for me, nothing has changed. It's just that one now has a different responsibility of having to balance the interest, because previously I would only focus on the interest of the sector, which is the workers. Of course, COSATU doesn't only deal with the employed people, we also deal with issues of the unemployed, because we understood that we represent the society, because the worker, when he leaves the workplace, goes and becomes a community member. So issues of the community and issues of the workers are intertwined, and you can't separate one from the other.
All right, MEC, thank you so much for your time this evening here at SABC News. And that is MEC Monyatso Mahlatsi. He is the MEC for Health in the Free State.